most famous physical therapist on the internet.
Let's get it rolling. Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together, we're the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Today, we're going to talk about 15 common exercises you should never do. This is an updated video. We did it once before. And what do you say, Brad? This is based upon science and our professional experience, right?
And some personal experience. But we're going to explain why there's definitely better options than what we're going to show here.
Yeah, some of these are going to, I know, is going to cause some arguments.
Right.
Some people are going to say this is a little bit controversial, but
they can get their own show.
Yeah, get their own show. I mean, we've done this, we've been working out now, Brad, for 50-some plus years, and so we kind of have our opinions. By the way, if you're new to our channel, please take a second to subscribe to us. We provide videos on how to stay healthy, fit, pain-free. We upload every day. Also, you're going to want to join us at bobandbrad.com. Go to the giveaway section, because this week we're giving away the Sleepy Bros. Oh, yeah, we got to do it sound like a trumpet going on. Yeah.
Sleep Ovation mattress.
And possibly a pillow, too. They're going to give away one of those, too. Great mattress. Brad and I are big fans. You can also find it at Bob and Brad on Facebook. It will be pinned to the top of the page. Go to Twitter and Instagram if you want a 60-second version of our program every day. Brad, let's get started.
Okay, this is the number one, but this is the start. But it's a big one. This stretch right here. Bend over, stretch your hamstrings, your back. Oh, see how flexible you are. Don't do that one.
Yeah, terrible on your back. Right. Absolutely terrible on your back.
And the other thing that does the same thing, don't touch your toes standing, or don't stretch out in a long seated position.
It's rounding out your back. It's putting a lot of stress on the discs and ligaments.
Right.
It's stretching out ligaments too, which makes your back more unstable.
Yeah.
So, no good.
Number two?
Yes, number two.
This relates directly to that one, just different part of the spine, is people that stretch their head forward like this and try to stretch like this. These two, Bob and I just strongly, just don't ever do them.
Yeah. The thing is, you don't need to stretch your neck into flexion, because that's the problem. Your neck is normally flexed all day long.
Right.
I mean, it's not extending enough into the other direction. Right. So that's the problem.
Yep. So just forget about doing that stretch. Yeah. I mean, I've 20-some years of therapy. I've never, ever taught a patient to stretch those muscles.
It can cause more problems than it can help, by all means.
Now, you're going to have to move, Bob.
Sure.
Oh, sorry. And there's going to be some controversy on these.
People will disagree on this.
Right. Not so much this one, but the old-fashioned full sit-up. That one, it definitely works the abdominals, but it stresses that low back and the discs in the low back.
Multiple studies on this have shown this, Brad.
Right.
Dr. McGill, he went into great detail on this.
So that one won't be too controversial, but this one, people looking for their six-pack.
Right.
And I can't even do this very well. It hurts my back because I got a particular back issue, but it's here doing your V sit-ups like this.
The same thing.
Right. Especially with a twist.
Rotation, yeah.
Rotation.
Deadly on your back. Deadly. If you want to hurt your back, do that one.
Right. Yeah, there'll be comments on that.
Yeah.
Anyways,
by the way, I don't have my full six-pack. I got 3-packs so far. I stole that from a comedian. Okay.
And should the wide-based
push-ups. I'm going to do it with my tie and everything. But the problem with this is you're really getting the shoulders in a precarious position.
Maybe you should go the other direction.
Like this?
So, we're talking about, I used to do these a lot when I was younger. Get your arms out as wide as you can to work those pecs from a different angle.
Oh, that hurts on my shoulders.
Well, that's because you're old, Bob. But it does. When you put your shoulders at end range, which just gets close to that, it really stresses that rotator cuff, the capsule, all those connective tissues on the anterior.
Are small muscles to a large extent. You're not using the larger pectoralis muscles. You're extending more into the smaller shoulder muscles.
And, that one in particular, as you get older, you'll say, I really think that's a good idea not to do it. The younger people really
I think it's, what it's also hard on, Brad?
What?
It's hard on the end of your collarbone. The joint, on the end of the clavicle.
Oh, really?
Yeah.
Oh, like that. Oh, yeah, sure. The AC joint.
Right. Exactly.
Good. Next one, tricep dips.
Sure. I'll hold it, Brad.
Yep. So a lot of people will do this, and it's a good tricep exercise, but your shoulder gets a lot of stress, and it's at end range. And you put any joint at end range and then put a lot of stress through it,
Yeah.
you're stressing a lot of joint tissues.
You're looking for problems.
Yep. And there's
And
a
you'll
lot better,
find them.
there's a lot better ways to do the triceps
Right.
without stressing
That's
the
the
shoulder.
whole thing. With all these, there's better ways to do them. Why do them the way that could possibly injure you?
Right. The next one. Oh, where's our
Military one, booyah?
Yeah, we're just going to pretend we have a barbell here with some plates on the end. And it's the military presser going straight overhead. And this one is hard. You know, it can.
Well, especially you do it behind the head. I've
I
seen
was
people
just
do
going to
that.
get into
Yeah.
that. But impingement problems with the shoulder and the supraspinatus tendon, it's going to irritate it. And if you go behind the head, and then you're not only working your shoulder, but then your neck is out of.
And you're really extended on the shoulder.
Yeah, both the shoulder, your head goes forward. It's a double whammy. That one is really a big no-no.
You know, I've had people that have argued with me on this one doing these, and I'm
Yeah.
like, go ahead, keep doing them, and you'll come and see me eventually. Because I remember one of the shoulder experts from lacrosse, the physical therapist.
Oh,
you had him as
George
a
Davies,
you're
yeah.
George Davies said he used to go around and hand his card out to people that were doing those because he knew they'd be coming to him soon.
The next one is, we call them long arc quads or knee extension. And particularly in a gym where you have a machine and you can
Right.
put a lot of weight and the pads are on the front of
Yeah.
your ankle and you're going out like this. It does work those quadriceps
It does.
quite well, but it stresses the joint, particularly the kneecap as it's going through there. There's a lot better ways to work your quads.
Well, for one thing, there's functional ways that are better. I mean,
Sure.
when in life do you do stuff like this? You know, but in life you're doing a lot of this.
Right.
So strengthen it that way instead
Yeah,
of
use a closed chain versus open chain.
There we go.
So anyways, let's go to the next one. Upright rows.
You're gonna need your booyah stick again.
Oh, yes. So we're talking about when you have the barbell, you got your plates on, and you're here and you're trying to have good posture, and then you do this one. You know, it's definitely working your shoulders, but again, that supraspinatus tendon, that rotator cuff really is being stressed, especially at the upper range.
Well,
of
plus
this
you're internally
exercise.
rotating your shoulder. And,
Yeah.
and that's actually how we test for impingement problems.
Right, exactly.
So you can create an impingement problem just by doing this. It's funny, Mike and I, the cameraman, were just talking about this yesterday. He says the hands used to get numb, or his arms used to get numb doing these when you were younger, right, Mike? Yeah. So he's nodding.
How old are you? Over 30 yet? Oh, he's 32. He's old now.
Yeah, now he's sliding down the hill of
All right.
life.
The next one. This is people if you like to walk or run.
Yeah, here I brought this, Brad, to show.
Oh, you did.
So, like when you walk down the road, there's a kind of a camber to the edge of the road.
So the water runs off.
Yeah, so the water runs off. If you always walk that side,
Yep.
you're stressing the ankles and the feet and the hips
And the pelvis,
and
the back,
knees.
the whole works.
all the same way. So you want to go down one way this way, but then you want to go down the other way this way, so you even it out.
So actually, if
basically.
you walk down the road, you have to turn around and walk on the same side of the road.
Exactly, and that's what I do. I when I run down the road, I run down one side and I run back down the same
The
side.
same side.
And if
Sure.
you're on a track, an oval track, you want to run one way and then reverse and go the other way too.
Well, not necessarily in the same day, because then you'd be doing back and forth.
Yeah, I know, but
I know. Actually, like where I run at the Y, it's indoor. On Mondays you run one direction. On Tuesdays they have everyone run the
Oh, they do?
opposite
Cool.
direction. So every other day they alternate it.
and some tracks are flat. You know what I mean?
Right.
They don't really have the oval.
But even then, you're turning the same way.
Yeah, that's true.
And
Good
as fast
point.
as I run, I'm at quite an angle when I
Oh,
go down the
good
corners.
Lord. Yeah.
It kills me.
His
Bent
ha-
over rows. Let's go on. So we
Sure.
don't have to
Am I
think
doing
about-
these?
Yeah, go
Yep.
ahead.
Okay. So the big thing with these is especially if you have people that are keeping their legs straight
Yes, I've
and
seen
they're
this.
rounding out their back.
Yeah, get over. I see they're really over.
I don't even can't do it round out much because I never round my back out.
I know it's
And which is good. But
Yeah.
I actually feel a lot of stress already. And then to add that force on there, oh my God. So, I mean, it's a little better to go ahead and bend your knees
Yep.
and keep your back straight and keep your head up and work
right,
this way.
Right.
I still wouldn't, to be honest, recommend those either.
I think there's better ways to do that.
right.
And again, there will be definitely some
People
people
that
saying,
disagree,
yeah, but
right.
that's okay.
We still love you. We hope you still love us.
Yeah, exactly. Wait till you get older, you'll find out.
Yeah,
why
yeah.
or after you see 300,000 patients with backaches.
Right.
The next one, standing lateral flexion with weight. In other
Sure.
words, grab one of those
Oh,
kettlebells.
kettlebell?
Yeah, because usually people get quite a bit of weight with this one
Sure.
because these muscles. It's a good core strength, and we were discussing this before. I think it does work the core muscles on this side fairly well. But if you've got a back problem at all, or just a hint of a back problem, there's a chance this is gonna make it quite a bit
Right.
worse.
It could give you a disc problem on this side
Right,
because you're flexing and you're forcing that disc
right.
to go off to the side. You can actually cause a lateral protrusion.
And I guess I'm
So
really concerned when I see people, especially guys, they think, well, we better put maximum weight so they'll have, 50, 100 pounds or whatever they can get, and they're really working that. Man, you're just putting your discs
you
at
want to
some
strengthen
stress.
your core isometrically to a large extent,
Sure.
so that it's strong and it'll have endurance.
Right.
You don't necessarily need to be doing the movement like this.
Yeah. So,
So
and again, that one is going to be controversial.
right,
That's an our opinion one, or mine in particular.
I agree.
Windmills. Why the
Yeah,
windmills?
so prefs are going down like this. You're flexing and you're rotating and you're bending. All certain movements, all movements that are bad for your back.
Yeah, particularly the low back.
Yeah. Now, some people are really flexible and they can keep their back
Yeah.
fairly straight. It's better, but it is, again, these serve almost no purpose whatsoever.
I actually like doing them. They kind of feel good on my shoulders in the rotation, but again, the low back is really taking quite a bit
Taking
of
a beating there.
yeah.
Yeah.
So yeah, the windmills, we're gonna give those on the list. The next one, it's a family show, so I cannot say this. The buttocks to the grass.
Yeah.
That-
Or A to the grass.
yeah.
A.
In other words, or the butt wink. People who like to do squats, which I think squats are a great exercise.
Right.
You're working a lot of muscle groups, but once you get past that 90-degree here in the quads, and there's going to be saying I have bad form with this because I don't do these, so I do have bad form. But when you get your butt way down, not only are you stressing the knees, but you're stressing not so much your hips, but the low back and that butt wink, and those lower discs are really under
Yeah.
stress.
Well, the thing is, if you are built that you have really shallow hip sockets,
Yep,
like certain Europeans do,
sure.
you can almost go all the way down and all the movements taking place at the hip and not the back.
Sure.
The back is still staying straight. Average person, no. Like if I go down so far, I'm going to go so far by the hips and then my back's going to start to round out.
Right.
And so
right.
you just can't get away from it unless you're anatomically built correct,
Right.
that your hips going to allow
Right.
you really to sink down.
So, and we've got comments from people say, "Yeah, I blew my disc out doing my deep squats,"
Right.
and it's just going to happen. Certain people, their bodies are not made for that.
I mean, if you're competing, that's one thing. But to me, you're just trying to strengthen for life or to strengthen for size. You don't need to go all the way down.
Right.
There's just you'll still strengthen without having to go the
Right.
entire range.
And the number 15 one, this is no one's going to argue with this. But
Oh yeah, yeah.
people, and this is just not being aware of body mechanics and
And
strengthening.
gravity.
But some people, what we have seen, they're thinking about working their chest muscles,
Yep.
and so they'll take some dumbbells in a standing or seated position and
They go out like this.
back and forth like this.
Gravity goes this way. Gravity doesn't go this way.
So
If
there
you-
is no, your pecs are not getting worked at all.
Yeah, you
with
have
that.
to go against gravity in order
Yeah.
to work the pecs there.
I
So-
know most anybody that lifts weights say, well, that's a no-brainer. But we've seen
We've
this.
seen this, and actually, the only way you could do it would be to use the exercise bands, and then you could certainly do it.
Right, but yeah, not with weights.
no,
so-
you're not. You're working. All you're working is the
Yeah.
deltoids there, and you're not working the
Yeah.
chest.
So after this, you're going to say, well, it looks like I can't do anything, but that's not true. There's
no, there's
a
lots and lots of.
plethora of exercises or alternatives to work all the muscle groups, get you in shape and pain-free, Bob.
There we go. Couldn't have said it better myself. Thanks for watching.